Hi everyone, my name is Akila,
And my name is Conrad.
and together we are here to talk about patient rights. And this is so very important because you must know your rights and obligations when you access the public healthcare system of Trinidad and Tobago. So, what are patient rights? Patient rights come from a policy called the Charter of Patient Rights, which ensures equal access to quality healthcare within Trinidad and Tobago's public healthcare institutions. It stipulates or outlines the approach to patient healthcare and explains what you are entitled to as a patient.
So know your rights. It entitles every patient to equal access to consistently high standards of care and protects every patient's civil and religious liberties, including the right to independent personal decisions and knowledge of available choices.
So let's talk about more of these rights. The first thing is that every individual, whether children, the homeless, the old and infirmed, or persons with disabilities, every single person has the right to impartial access to treatment without consideration for race, sex, religion, gender, or social standing.
And you have the right to respectful treatment from all healthcare workers at all times and under all circumstances. You have the right to know how long a procedure might take.
You also have the right to privacy of your person. You have the right to request that a person of the same sex be present during your examination. Your information should always remain confidential.
And you have the right to expect safety and security for both you and your property whilst at a health facility.
You should not have to deal with mental, sexual, or physical abuse, intentional or otherwise. No one should be causing you emotional or physical pain or injury without cause or reason.
And you have the right to know who the healthcare worker is that is treating you and to know exactly what their job is.
You have the right to know what your diagnosis is. You have the right to up-to-date information, as well as treatment alternatives, risks, and prognosis.
You have the right to access people other than hospital personnel via visits or oral or written communication. You have the right to interpreters to assist you with communication.
You also have the right to be told about your health and treatment and to participate in any decisions that concern it.
You have the right to participate in the planning of your healthcare upon request and at your cost. You have the right to a second opinion.
However, you also have the right to refuse treatment or care.
You have the right to express your religion and culture whilst admitted, as long as they do not interfere with the normal activities of the health facility.
Be aware that you have the right to file a complaint when you consider your rights were infringed.
You or your authorized representative have the right to access a copy of all your records.
You have the right to participate in the planning of your health care. You can include a family member if you wish.
If you are brought to a facility unconscious or unable to communicate, the facility shall make reasonable efforts to contact either a family member or a designated person on your behalf.
You have the right to be cared for with reasonable regularity and by the same healthcare professional as far as the facility policy allows.
You shall expect to receive medical and nursing care from professionals who are registered, enrolled, or listed by the regulatory councils.
It is very important to remember that at some of the district health facilities, you can expect extended hours of services, x-rays, laboratory tests, specialist clinics, health promotion information, and even visits from the health visitor, district nurse, or midwife as necessary. You also have the right to receive information about services and medication, eye care, and dental care from qualified professionals registered to practice in TNT. You have the right to knowledge of the cost of your prescription and the right to view the expiration date before deciding to purchase. You have the right to retain the attached literature, the medications provided. So it is very important that we remember our rights. Be aware and take care of yourselves.